Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. Hi everybody, I hope you're well. It has been a while since my last video, as I have been traveling over the last 5 weeks, and being on the road and making videos can be sometimes challenging, but here I am. In today's video, let's explore how you can manage and heal genital herpes with natural and effective therapeutic tools. Genital herpes is quite common. It's caused by a contagious virus, and it is the #1 cause of genital ulcers worldwide. As the virus is transmitted sexually, and it is said it's incurable, getting the diagnosis can be quite overwhelming. And next to the physical symptoms, one maybe experience feelings like shame and guilt and anxiety, which I also would like to address in this video because no one talks about that. But there's good news. There's plenty of ways how to meet this situation with acute outbreaks, diminishing the risk and susceptibility of getting the herpes in the first place, as well as sort of helping the spread of the herpes through other parts of the body. So in this video, I will give you great tips how to meet this situation. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for all your thumbs and your likes. Leave your comments below because I really would like to know how I can meet you better with future videos. And if you want to learn more about my work, go to the website medicanova.net. At the online academy, you will find comprehensive and certified home study online courses in homeopathy for the whole family, also applied during pregnancy, birth, postnatal care. You maybe want to learn about mental health and what to do about it. How about health and wellness coaching, quantum healing, and so much more. Medica Nova also released and launched the 3 months holistic smoking cessation program, as well as the complete cellular detoxification system. So if you want to know more about it, check in with my website or my email health@medicanova.net. So what are genital herpes? Let's educate ourselves first before we sort of dive into the remedies and the lifestyle changes. Genital herpes infection is caused from the herpes simplex virus. It's called HSV. And there are 2 primary types of them that are responsible for the vast majority of genital herpes. And it's called HSV1 and HSV2. Once infected, someone with genital herpes develops skin sores or ulcers around the genitals and sometimes also feels other symptoms. And we talk about more of that in detail too, but often people say, I'm really achy, or I feel tenderness near the groin, and I have this fatigue. I know I'm getting an outbreak. In the past, experts found that HSV2 was responsible for causing most genital herpes infections, but today an increasing proportion of genital herpes infections are actually due to HSV1, commonly thought of the mouth herpes, like the cold sores, when you get a flu or you're exposed to too much sun and you get all these cold sores on the lips and around your mouth. Contrary to what most believe about herpes, HSV1 doesn't just affect the membranes on the lips or inside the mouth. It can also spread to the genital areas. In addition, although it's rarer, genital herpes can also be acquired from contact with cold sores on the eyes, secretions on the fingers, or ulcers and sores on the buttocks and upper thighs. It's not uncommon to see the herpes more around the buttock area. Experts now believe that the oral transmission, primarily due to transmitting the HSV1 from mouth to genitals, is therefore the leading way that people are acquiring genital herpes. So, teens and young adults should be educated here. Really, practice safer sex, use the condoms, use your precautions here. The virus can live dormant inside a person's immune system for a lifetime even, and periodically causing maybe these blisters that burst and turn then into the sores before they heal. Both the HSV1 and the HSV2 infection are acquired from direct contact with someone who carries the virus. The infectious secretions that pass on the herpes live on therefore the oral, the genital, and also the anal mucosal surfaces. So we need a skin-to-skin transmission here. But you don't need to have necessarily sex or intercourse to, that the virus reaches the genital tract. Any form of intimate skin-to-skin contact is capable of passing on this virus, including contact with sores on the buttocks and the mouth, as I mentioned. But you cannot really contract the virus, for example, from a toilet seat or swimming pools or towels, bedding or any other object. So we don't go overboard here, Wade. Now, the virus also cannot survive for a long time outside the body. So that's why it's really important to explore who you're with, who you're intimate with, and how to really stabilize your immune system so you don't get future outbreaks. Research has shown that the majority of patients with genital herpes have virtually no symptoms at all, and they don't even know they have it. It's also very common to experience a noticeable outbreak only one time, and then for the virus to remain dormant and never come up again. So I often get asked, how long does the outbreak really last? And each patient is different, of course, and unique, but I would say it takes about 2 to 4 weeks, to the whole healing. Again, newly infected persons with genital herpes maybe experience the first outbreak, usually after sort of 14 days of the infection. Outbreaks are more common within the first year of infection and then often tend to decrease substantially as time goes on, or maybe never even come up again. It's possible that you can carry both types of virus, HSV1 and HSV2, but they cause also different symptoms maybe at different locations at the body. So we have the primary genital herpes, and is the term for the first episode of an individual, and they have no pre-existing antibodies to either type of the herpes virus. And then we have the non-primary first episode, and is the term for someone having a first-time outbreak, even if that person already has pre-existing antibodies to the other type of herpes. For example, someone was infected with HSV1 as a child, and you have the cold sores and all those things, but then as an adult also attracts the virus of HSV2. So we see either a single cold sore or a cluster of multiple cold sores. We call them vesicles, and they can sort of place themselves around the genitals, the buttocks, the upper thighs, near the groin. The primary outbreaks often become quite severe, maybe a rupture and cause some fluid to be secreted out. Sometimes the cold sores ulcerate and become very painful, exposed almost, and develop also white coating and burn for a period of time. Of course, it's common to experience pain, tenderness. Sometimes there are rashes involved, and definitely a redness is a sign here, maybe some swelling. In men, the genital herpes sores are mainly located at the base of the penis, the scrotum, or the surrounding area. In women, you see it more around the vulva, vagina, and the cervix. But also in women, there can be a lot of pain while urinating, right, because it burns so much. Others experience these symptoms of almost like having a flu, and you feel very fatigued. Maybe there's some body aches involved, sometimes even fever. Most of them can tell that they get an outbreak because they feel a tingling sensation, an itchy sensation maybe. Sometimes they feel quite irritable, or just this feeling or this notion of you're getting sick. Sometimes there can be complication, especially with the virus HSV2. And once this is really setting hold in your body, you can maybe be susceptible to other types of viruses, in this case HIV virus. Other complications, of course, which are rare, include nerve damage, neuropathy, maybe trouble going to the bathroom. We call it urinary retention. That means you want to pee, but it's not coming out. Or even a higher risk to meningitis. So the ones which are more at risk are those who are having multiple sexual partners, having sex without protective measures, barriers like condoms, but also the ones who have a low immunity. And this is where I would like to come in this video to just show you the remedies, how to meet this whole complex situation. Women are a little bit more affected here than men, but after the first outbreak, the virus remains, as I said, dormant or inactive in the body. And it can become active anytime when there are triggers. So the triggers can be maybe a stressful situation. You have problems within your marriage, your sexual relations don't work anymore. If there's an illness, right, you had a strong flu and your immune system goes down and suddenly you have a herpes outbreak. Usually it's stress. I see it a lot among women and patients that's the time when it comes out. The sores may keep appearing off and off, on and off for many years. In some people, the outbreaks may occur several times a year, while in others, the sores may repeat less frequently. And that's why you need to sort of create a targeted protocol for the individual patients. Of course, if there is pregnancy involved, having genital herpes while you're pregnant is not great. In this case, most likely you will be suggested and advised to have a C-section, cesarean section, because if the virus is passed on from the mother to the baby, there can be maybe complications like blindness, damage to the brain, and even fatality of the baby, so we don't want that. So what are the conventional treatments? But usually you get certain medications, preventative measures, maybe some creams and ointments to help lower the pain and the inflammation near the site of the sores. Over-the-counter painkillers will reduce the aches, the tenderness, and the fever. And of course, for pregnant women, as I said, drastic measures will be taken to protect the mother as well as the baby. But there are other ways and more natural ways how to deal with this situation in the long term. If you are interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. As with all of my previous videos, my emphasis as a healthcare practitioner lies on and focuses on the totality of symptoms. It means I want to treat you as a whole person, not just the physical symptoms. And when your body, especially in the reproductive area, shows quite a strong symptoms, we want to look at the story, the mental, emotional aspects of your life, especially your sexuality and your relationships. I call this section of the video the food for thought or the metaphysical meaning. And here I was refer to Jacques Mattel's references. He says vaginal herpes, following popular belief, derives also from sexual guilt and the unconscious desire to punish oneself. Remember in the beginning of this video I said that, getting the diagnosis can bring up feelings like, oh my God, shame and guilt and what have I done? And often these aspects are just pushed under the carpet. Nobody wants to talk about it because it's uncomfortable. But from my standpoint, these aspects are prime to heal the physical symptomatology as well, right? It all goes hand in hand. And here the mind-body connection is absolutely important to be looked at. Genital herpes can appear if one senses the absence of sexual contact. I may have had a partner and we separated, which makes me feel frustrated. Or we may have been physically separated, as when one of the partners has gone maybe on a business trip for a period of time. Having no physical contact with the skin of my sexual organs and finding this separation very difficult maybe shows in this uneasiness, and then that's the trigger to experience vaginal herpes again. There's a frustration involved with this whole situation, and it can be intensely linked to my sexual relations, either because they are not satisfying, or on the contrary, because while being fully satisfying, they bring up maybe unhappy memories. I recall a patient who experienced, extreme physical and sexual abuse as a child. And later on, when there was sexual intercourse with the husband, the herpes came up. Right? It's not uncommon. I've seen it many times here. In other words, I may wonder why I have endured so many years of dissatisfaction when today it is going so well. So why didn't I experience this earlier? There's always a timing when your higher soul, your higher consciousness knows it's the right timing for you to get in contact with maybe uncomfortable experiences from the past. Sex and religion goes hand in hand too. So common religious teachings even asserted that this more maybe was willed by God or a higher force to punish us. And the feeling, therefore, of shame even leads to more denial or not accepting even the genital organs or the masculinity or the femininity within the patient. Genital parts have been often scapegoats for many religions. So what would be the positive affirmation here? Well, you start with to accept and become aware of the fact that I want to escape my deeper nature, right? I don't want to look at certain things. I'm vulnerable, like all of us. I'm ready to engage myself totally. Look at this stuff, what's coming up now. I love my body and I rejoice in my sexuality. God has created, or the higher divinity, whatever name you want to give to a higher force, of course, is created in His and in my own image. There's no division. I'm not less than divinity. I'm amazed by the beauty that I embody, and I must totally accept myself and give myself completely to myself in order to then do the same with my partner. So, in order to heal your genital herpes, I invite you and welcome you to really ask your body, what do you need? How can I help you? Obviously you are expressing something on a monthly or regular basis here. And what am I missing? Me missing here in order to really break this cycle of experienced genital herpes. And the body is your best friend. It will always give you the right answers if you're willing to engage with it. It's not an enemy. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So let's look at the natural treatments and what to do about it. First of all, education here is important, especially among teens and young adults. Practicing safe sex, I mentioned that before. If you're infected, safe sex is therefore even more crucial for protecting your partner. Now, one of the reasons they say so many people don't know they have genital herpes, and it's up to 85% of those carrying the virus, is that often doctors really check for herpes when they perform maybe standard STD check-ups. So ask your doctor, say, could you make another test, please? Because up to 80% of people carry the HSV1 virus, and 30% maybe carry antibodies of the HSV2 virus, and many people even carry both viruses. Tests are useful, right? And you got to speak up and ask your doctor, could you please check me on herpes as well? Your immune system is prime here. So this is what I want you to look at. Yes, you maybe have the herpes, but you can take care of that if you take care and boost your immune system on a regular basis. And that really starts with lifestyle changes. If you are exposed to processed food, unhealthy diet, your immune system will be directly affected here. Please bring or implement a healthy diet, nutritious diet. Avoid smoking, using any drugs. Exercise, right? It boosts your endorphins here with your immune system. Needless to say, manage stress, get enough sleep. Limit also the avoid or the use of too much antibiotics and medication, as they affect your gut and your digestive system and your microbiome, which then again results in a sort of depleted immune system. Toxic chemicals in general, I would say, your environment has to be as healthy as possible. Homeopathic remedies, one of my favorite subjects, of course. I would like to introduce them here because they play a prime part, not just a little part, but a prime part in the prevention as well as dealing with the acute outbreaks. There's a great scope of treating genital herpes in homeopathy, and the homeopathic remedies for genital herpes, they're made from natural substances that boost the body's defense mechanism and the immune system, and that's what we want to fight against the virus and to overcome the infection. So it's not just a placebo or a band-aid situation. We're going to go deep here. With natural homeopathic remedies, the frequency and intensity of genital herpes eruption, they wither slowly till the disease is diminished completely. And therefore, I do not accept that it's an incurable disease. I believe that it can be managed and it can be cured to a large extent. So you have a good quality of life here. And not just you just run to the pharmacy and get your creams and your painkillers. I mean, that's just a very sort of shallow healing in my understanding. For more guidelines and to book your appointment, contact Medica Nova at health@medicanova.net because you need a practitioner here. The remedies which I will suggest here, you will get online. So you have access to it. You don't need a prescription by your doctor, or even can be purchased via your local health food store if there's stock homeopathic remedies. The first remedy is called Natrum muriaticum, and the potency is 30C. That's the number behind the name. These are Latin names, but mostly they're made from plants, minerals, sometimes animal products, but of course it's animal cruelty-free here. So Natrum muriaticum 30C would be a good remedy, and it's the top listed homeopathic remedy for treating genital herpes in both males and females. So let's look at the keynotes, because the idea is that you will recognize the most indicated symptoms of your genital herpes, because everyone is unique, right? One have more the ulcers, one have more the itchiness. So according to your keynote, you will choose the appropriate remedy, and then it works. In males, Natrum muriaticum can be used when the blisters form at any part of the genitals. That can be the scrotum, the penis, the glans penis, which is the rounded head of the penis, and on the thighs, maybe around the anus. And the keynote is there's itchiness and stinging pain on the scrotum, maybe the glans penis. In females, we see the bumps on the vagina, the vulva, and around the anus. Again, we have this burning and soreness sensation in the vagina, especially felt after urination. Can be worse before the menses, of course. So there has this itchiness in the vagina. In some cases, there may be even a white discharge from the vagina, again accompanied with itching and burning. You can use several potencies from 6 to 30. That's the potency you can get over the counter, and then maybe go higher later on, but here you need a homeopath or professional healthcare practitioner who is trained in homeopathy. But for adults, I would say 1 tablet morning and evening with the potency 30C for 10 days. See how that works. You can then go down with the dosage plan with 1 tablet daily, maybe for months. But also you need to boost up your immune system here. Maybe some vitamin C comes in, some zinc, some lovely just immune boosting supplements. And here I swear on medicinal mushrooms. You know, get a complex of medicinal mushrooms. It's wonderful. The next remedy is called Petroleum 30. And next to the itchiness, we see here a marked redness. Maybe even cracks. Petroleum is the most important remedy when the bumps are accompanied with marked itchiness but also redness. In males, you see the eruptions mainly around the genitals, dominantly on the scrotum and the prepuce. Again, itching bumps is felt intensely, and the whole area, the skin turns red, which maybe sometimes ooze some fluid, or they remain dry. Here with petroleum you see cracks and even bleeding with the cracks. In females, again, we see the breakouts mostly often during the menses. Also, itchy bumps may occur scattered on any part of the genitalia, can be even in the perineum, sort of like between the anus and the vagina. I've seen that a lot with patients too. A burning sensation, cracks and bleeding is here the remedy. Again, one tablet, maybe 2 to 3 times a day in the beginning, and then you reduce the dosage plan as you go along. We talked about that genital herpes is also the #1 cause of genital ulcers worldwide. Right? Ulcers means like it's now an open sore and it's really, really painful. And nitric acid is a fantastic remedy here. It's the most important remedy to treat ulcers in genital herpes. In males, again, we see these ulcers, they form more on the scrotum and the foreskin. Often we see sort of it exudes a foul smelling moist fluid, in some cases even blood, and the sores are extremely painful. It's almost like nitric acid has a very stinging, sharp pain as if a knife hits you, right? It's not just the genital herpes with the itchiness and the burning. This is a grade much higher, and therefore we need different remedies for that. In females, nitric acid is useful when the ulcers are formed in the vagina. Again, itchy and burning sensation, but very, very painful, almost like this sharp sensation with it as well. Nitric acid, you think about ulcers and not just genital herpes in general. I want to pass on a remedy which I also often use called Sepia officinalis. It's the cuttlefish. It's often indicated more for females, for genital herpes. And here we see blisters that form on various areas of the female genitals. Marked tenderness of the genitals is here felt, again next with the itchiness, but there also can be a yellow-green discharge from the vagina along with the itchiness. You know, with sepia here we talk about, as well as the Natrium muriaticum, the first indicated remedy, about the shame and the guilt and the anxiety which comes with it. So let me sort of go more into the mental emotional aspects here. With Natrium muriaticum, which is the first remedy I would start off, you know, if it's just general genital herpes symptoms, there is often this feeling of shame, resentment, maybe grief and loss, long-term silent grief involved. You know, you withdraw and you know something wasn't right and something was bad done to you, but you know, you keep it inside, you don't want to talk about it. Whereas with sepia, you have this feeling of truly having frustrations with your spouse. You maybe do all the work and you feel like he or she's doing nothing, and you take care of your 5 kids and you're completely exhausted. It's not lack of love, but you just don't have it in you anymore. And with that comes this feeling of a little bit indifference towards your loved ones that can be even directed to your children or your husband or your wife or your spouse, where you feel like almost like, I'm so exhausted, I don't care anymore. That is very much sepia as well. Therefore, maybe the libido, the sexual desire, diminishes, and sepia is a fantastic remedy indicated during menopause as well. So you have to really look at the totality here and look also you know, what is the mental emotional aspect in order to choose the right remedy. Again, the potency 30 I think would be indicated here. Initially sepia 30 maybe once or twice a day, and then diminish with the dosage plan as you go along. The last remedy on my list is called Herpes sulfuricum 30, and here we have the high sensitivity of eruptions, particularly on male genitals. It's highly effective when you see the eruptions, again more with the males, and you have these little blisters that form maybe in groups. They look quite white but with a red base. But the keynote here, they're extremely sensitive to touch, right? You don't want anybody or you even to touch these because it's just very painful. That's why I said it's highly sensitive eruptions here. It's safe to start with a 30C potency, again 2 to 3 times a day. But as with all the remedies, after a while, as maybe a preventative program, you want to do it only once a day, maybe for 1 or 2 months, or especially when you know you enter into a stressful time. Women, patients maybe, or males go through a divorce, for example, there it comes again, or they had a big row with their spouse and there it comes again, the genital herpes, right? Or as I said, some sort of dormant underlying sexual frustration, either caused by childhood trauma, we have to spit it out, from abuse to rape to mistreatment as a person and also in the sexual area, as well as acute misconduct, right, between the two partners here. All of that can be a huge part here. So I hope that today's video has given you more insight and also more natural solution how to meet having genital herpes. There's nothing to feel ashamed about. You can deal with that. As I said, there are plenty of ways on the market as well, on YouTube, where you can heal this more in a natural form. For more guidelines and to schedule your appointment, contact Medica Nova at health@medicanova.net. Lastly, take a look at my website, medicanova.net, at the Online Academy, where you will find a 16 weeks comprehensive certified course in homeopathy, where you learn how to apply homeopathic remedies for your whole family, your loved ones, as well as yourself. And yes, we talk about remedies, about genital herpes here as well. If you want to learn more about mental health, Medica Nova offers an 8 weeks course. Health and wellness coaching, again, is a long 16-week extensive course. We also talk about homeopathy, maybe with another course, during pregnancy, birth, and postnatal care, as well as sort of short courses to relieve stress, boost your sleeping pattern more. I am also a university faculty instructor, so I'm very well versed in educating students, and I will guide you through these courses with a beautiful created curriculum, with handouts, with PDF files, with homework assignments, and lots of Zoom meetings. So either in a group setting or individual, I guide you step by step through your study process. And lately, in the Medica Nova coaching department, we now offer a holistic smoking cessation program for 3 months. And on my website, medicanova.net, if you look under the wellness programs, you also find the complete cellular detoxification system, the most advanced system in order to really clean and restore your body. So lots more here. For more information, again, contact me at health@medicanova.net. Till next time, much love and take care.